Hello everyone and welcome back to Becoming Dentist. Today we shall be learning about Introduction to Dental Anatomy. As you know, in the last video we have covered the first 4 topics. So in this video we shall be covering the other 3 topics, that is the landmarks of tooth, division into thirds, as well as the line angles and point angles. Starting with landmarks. Now on the surface of tooth, landmarks are majorly of 2 types, or they are in the 2 forms. These are in the form of either elevations or in the form of depressions. They can either be as elevations or they can be as depressions. So elevations, we have cusp, tubercle, cingulum and ridge. And depressions, we have fossa, sulcus, groove and pit. So learning about each of them in detail, we have first of all the elevations. In the elevation, first elevation we shall be learning about is the cusp. Now cusp is an elevation or mound on the crown of the tooth. So as you know, this is the crown and this is the root. So these major elevations on the surface of crown are called as cusps. These are the major elevations of the crown. Now if we take a look from the occlusal aspect over here, we have 4 cusps. 1, 2, 3 and 4. We have 2 buccal cusps and 2 lingual cusps. Now due to the presence of these cusps, the crown is divided into 4 parts occlusally. As you can see, based on the location of the cusps, we can divide the crown into 4 parts. So we can say that cusps will form the divisional part of the occlusal surface. Similarly, in the premolar, the buccal cusp and the lingual cusp will divide the crown surface into 2, the buccal and the lingual. Now the naming of these cusps is done on the location of the cusp. How? Let us see. Suppose this is the buccal surface, this is the lingual, this is the mesial and this is the distal. So this cusp, which is located mesially and buccally, will be called as the mesiobuccal cusp. This will be the distobuccal, this will be the distolingual and this will be the mesiolingual cusp. Moving forward, we have the tubercle. Now as we know that cusp is a major elevation. It is a major elevation. So this tubercle is a smaller or a minor elevation. It is a smaller or a minor elevation. Now it occurs because of extra enamel deposition. Suppose in this tooth, if over here we have extra enamel deposited here, this will be called as the tubercle. Now in all the teeth, tubercle are not found. This is a rare case, so it will be deviation from the normal form of tooth. Next we have is cingulum. Now cingulum, now it is a lingual swelling. Now as you can see from here, we have learned about 2 terms, labial surface and lingual surface. So if we look at this incisor from the lingual surface, this is the cervical line. So this elevation or this mound over here, which is present lingually and in the cervical third of the tooth, is called as cingulum. From this aspect, as you can see, this convexity over here, this is the cingulum of the tooth. So it is the lingual lobe of the anterior teeth. It makes up the bulk of the cervical third. As you know, here the cervical third, and its convexity resembles a girdle. So this is a girdle. Moving on, we have ridge. Now ridge is any of the linear elevation. Linear means line-like. Elevation which resembles a straight line. So the first linear ridge is marginal ridge. Now as the name suggests, marginal. So this marginal ridge will be present on the margins. On the margins of the tooth. Now tooth has 2 margins. One is the distal margin and one is the mesial margin. So we will have the distal marginal ridge and the mesial marginal ridge. This is from the occlusal aspect. Similarly, from the lingual aspect of anterior teeth, we have mesial marginal ridge and distal marginal ridge. Next we have the triangular ridge. Now in this premolar, from here cusp tip, this is also another cusp tip. The ridge which moves from the cusp tip to the center of the occlusal surface. See, this is the cusp tip, from the cusp tip here towards the occlusal surface is called as triangular ridge. But now you will say no, this ridge does not resemble a triangle. So why is it named a triangular ridge? This is because the slopes of this ridge, here this slope and this slope, these two slopes will resemble the sides of triangle. So the slopes formed because of this ridge will resemble the sides of a triangle. Hence this ridge is called as triangular ridge. Next we have the transverse ridge. Now as you know, this is the buccal cusp tip, this is the lingual cusp tip, this is the buccal triangular ridge, this is the lingual triangular ridge. Now when these two triangular ridges will merge together over here, as they will merge, they will form one single ridge called as the transverse ridge. So the ridge formed due to convergence of two triangular ridges is called as transverse ridge. Next we have the oblique ridge. Now as we saw, that transverse ridge is formed by conversion of two triangular ridges. Now oblique ridge, oblique, it is like an oblique line, but it is formed by the junction of triangular ridge of distobuccal, this is the distobuccal cusp, so the triangular ridge of the distobuccal cusp and the distal ridge of mesiolingual cusp. Now why the distal ridge? Because the triangular ridge of the mesiolingual cusp will form the transverse ridge. So the distal ridge will fuse with the triangular ridge of the distobuccal cusp to form the oblique ridge. So if we see over here, we have the mesiolingual cusp tip. This is the triangular ridge forming the transverse ridge, and here we will have the distal ridge forming the oblique ridge along with the distobuccal cusp. Moving forward, we have the depressions. Now the first depression we will see is the fossa. Now fossa is an irregular depression which will be seen. It is an irregular depression or concavity. Now the first type of fossa is the lingual fossa. As the name suggests, it will be present on the lingual surface of the anterior teeth or the incisors. So as we saw, these were the two marginal ridges. So the fossa adjacent or depression adjacent to these marginal ridges is the lingual fossa. Next we have the central fossa. Now as the name suggests, the central fossa will be present in the center of the occlusal surface of the tooth. Here, where all the ridges here which will terminate, see these ridges will terminate, here at the center a depression is formed called as the central fossa. Next we have the triangular fossa. Now triangular fossa, these are triangular in shape. Unlike triangular ridges, they are actually triangular in shape. And they are found on the mesial and the distal side opposite to the marginal ridges. So they will be called as the mesial triangular fossa and the distal triangular fossa according to their location. Next we have the sulcus. Now sulcus is a long valley-like depression. Now imagine these two, this is the cusp tips and these are the ridges. Okay, now imagine these ridges as a mountain. So between the mountain where the lake runs, there will be a sulcus, right? A depression or sulcus. Now this sulcus-like depression or a valley-like depression is the sulcus. Here this valley is formed, and similar to the shape of this valley, we have a depression called as the sulcus. Next we have the groove. Now first groove we shall be learning about is the developmental groove. Now the developmental groove is a shallow groove or line between the primary parts of the crown or root. Suppose here we have two lobes which will join to four lobes which will join to form a crown. So in between these lobes, the grooves which will be running are called as the developmental grooves. As you can see over here, we have this developmental groove, this developmental groove. These are all the developmental grooves. And the grooves which are less distinct than the developmental groove, these small grooves which do not separate two developmental parts, are called as the supplemental grooves. And then we have the buccal and the lingual grooves which are found on the buccal and the lingual surfaces of the posterior teeth. So this is the buccal surface. So we will have here the buccal groove. In the roots also we have the buccal groove. Moving on, we have the pits. Now pit is a small pinpoint depression. You see over here, a small pinpoint, like the point of a pin. Here we have pinpoint depressions. See over here, these are called as pits. Now next we have a very important topic, that is the lobes. Now lobes are the primary sections of formation in development of crown. So as you can see, these are the primary sections of development. These different lobes will join, they will fuse together and they will form the crown. Cusps and mamelons are the representatives of lobes. Mainly all the teeth have 4 lobes, but in the mandible of first molar we may have 5 lobes. Which are these 4 lobes? We have the labial lobe, the lingual lobe, the mesial lobe and the distal lobe. So this is the labial lobe. On the distal side we have the distal lobe, here we have the mesial lobe and here we have the lingual lobe. So the labial, distal and mesial lobes will fuse together to form the labial surface of the crown, and the lingual lobe will form the lingual surface of the crown, hence forming a 3-dimensional tooth. Next we have the mamelons. Now on the surface of a newly erupted permanent incisor, you must remember, on permanent incisor which are newly erupted, we will have mostly 3 protuberances which are representatives of the fusion of lobes. These are called as mamelons. They are not seen in deciduous teeth. So as you can see here, when the lobes will fuse like this, here see this area, this part, this are called as the mamelons. Now moving forward, we have moving on, the next topic that we have is division into thirds. Now for the purpose of describing or description of a tooth, or to describe which part of tooth we are talking about, we will divide the tooth into 3 parts, the crown and the root into 3 different parts. Now these parts are named according to their location. Now starting with the anterior teeth, here this is the anterior teeth and this is the labial aspect of the tooth. So this is the incisal ridge and this is the apex of the tooth. So starting from the incisal ridge, the crown, this is the incisal ridge and this is the cervical line. So we will divide it into 3 parts. Now naming these parts, this part which is just above the incisal ridge, this part will be called as the incisal third. This part which is just below the cervical line, this part is called as the cervical third, and the part between them, this part, this is called as the middle third. Now as for the root, we will from cervical line to the apex, we will divide the root into 3 parts. This part just above the cervical line, will be called as the cervical third. This part just below the apex, this is the apex, part below the apex is the apical third, and the part in the middle of them or in between them is called as the middle third. Now going from mesial side to the distal side of the tooth, we will divide into 3. The side which is facing the mesial side will be the mesial third. The side which is facing the distal side is the distal third, and the part between them is the middle third. Now this was from the labial aspect. From the labiolingual aspect, this is the labial, this is the lingual. From labiolingually, the part which is facing the lips or the labial side will be the labial third. The part which is facing the tongue or the lingual surface is the lingual third, and the part between them is the middle third. Similarly, in the posterior teeth, from the buccal aspect, we will divide it into 3. So part near the occlusal surface is occlusal third, near the cervical line is the cervical third, and in between we have the middle third. And from mesial to distal we have the mesial third, the distal third, and in between we have the middle third. From the buccolingually, we will have the buccal third, facing the lingual side is the lingual third, and in between them we have the middle third. Now the next topic is line angles. Line angles. Now to understand this topic, first of all you will have to imagine the crown as a 3-dimensional cube in your mind. So this is the 3-dimensional cube. Imagine that the tooth is a 3-dimensional cube. Now this will have total 6 surfaces. So the surface which is facing directly towards you, imagine that as the labial surface of the crown. The surface which is away from you, the surface of the cuboid away from you, imagine that as the lingual surface. The surface on your right side, imagine it as the mesial surface, and the surface on the left side, imagine it as the distal surface. And the surface which is facing towards the ceiling, imagine it as the incisal or the occlusal aspect. After you have imagined this cube or cuboid in your head, it will be easier to understand line angles. So, a line angle is formed by where there is a junction of two surfaces. So, here as you can see, this is the cube, this is the surface towards your labial surface, this is the lingual surface, the mesial, distal and the incisal or occlusal surface. So, in the anterior teeth, where the mesial surface meets the labial surface, over here mesial and labial will meet, this is the mesial labial line angle. Here where the distal meets the labial, we will have the distolabial line angle. Then where the mesial surface meets the lingual surface, the surface opposite to you, we have the mesiolingual line angle. Here where the distal surface meets the lingual surface, we have the distolingual line angle. And where the labial surface meets the incisal surface, we have the labio-incisal line angle. And where the lingual surface meets the incisal surface, we have linguo-incisal line angle. So these are the 4 line angles, these are the upper 2. So we have total 6 line angles in the anterior teeth. Similarly, we have all these line angles in the posterior teeth as well, that is the mesiobuccal, the distobuccal, the mesiolingual, distolingual, bucco-occlusal, we have linguo-occlusal, and the 2 extra line angles that we have are the mesio-occlusal and the disto-occlusal over here. Mesio-occlusal and the disto-occlusal. So we have total 8 line angles in the posterior teeth. So 1, 2, 3, 4, 5, 6, 7 and 8. These are the line angles of the posterior teeth. Now we have the point angles. Point angles are formed by the junction of 3 surfaces. Here also imagine the same cube or cuboid. So we have where the 3 surfaces meet, we will have a point angle. So in the anterior teeth, when the mesial surface, the labial surface and the incisal surface meet, we will have the mesio-labio-incisal line angle. Similarly, on the distal side, we will have the disto-labio-incisal point angle. I am very sorry, it is point angle. Then we will have the mesio-linguo-incisal point angle. We have disto-linguo-incisal point angle in the anterior teeth. So we will have 4 point angles in the anterior teeth. In the posterior teeth, similarly, we have the mesio-bucco-occlusal point angle, the disto-bucco-occlusal point angle, the mesio-linguo-occlusal point angle and the disto-linguo-occlusal point angle. So here these are the 4 point angles and these are the line angles of the tooth. That is it for today's video. If you did like the video, do like it, share and subscribe and keep on watching to keep on learning. Thank you.